It's the Metro on WDET. I'm Robin Vincent. In a normal year, Michigan sees about 50 cases of a parasite called cyclospora. Right now, we have more than 3,300 and climbing. Stranger still, Michigan's own case count is now larger than the entire confirmed national total. The parasite cyclospora causes days, sometimes weeks, of explosive diarrhea, and health officials still can't tell you exactly which food it rode in on. Their best guess this week is lettuce. Given all this, something feels off. Not just with our salad, but with the system that's supposed to see these things coming. My guest has spent more than 20 years trying to fix that system. She came to the job the hardest way there is. In 2001, her 2.5-year-old son, Kevin, died after eating contaminated food. She turned that loss into her life's work. She helped create the blueprint for America's last major food safety law. Today, she directs the Institute for Food Safety and Nutrition Security at the George Washington University. Professor Barbara Kowalczyk, welcome to the Metro.
Thank you for having me. I'm really, at some level, happy to be here, but other level, not happy to be here, given the circumstances.
Indeed. Well, we appreciate you being here nonetheless. First, cyclospora, it can take a couple of weeks to even show up in your body. And then it can hang on for weeks more. Now, we recently spoke with Oakland County Health Officer Kate Guzman about the task of tracking the parasite. Let's listen.
On a local public health front, I have lots of teams, right? I have a team of epidemiologists and communicable health nurses and environmental health food investigators. And typically when we receive foodborne illness complaints, we'll see two coming from two different households in the same restaurant. We send out food inspectors. They go out and they talk to the restaurant owner and they watch their sanitation practices, and they can kind of quickly say, this is where the problem is. Let's either shut this restaurant down, get it fixed up, get them reopened, and nobody else gets sick. This is not at all the case right now.
Why has this become such a difficult parasite to track?
Well, there's a lot of different reasons, in the sense that cyclospora does have a long incubation period, 1 to 2 weeks. And typically what happens is, the only way you get into the system, our surveillance system, is if you go to the doctor, they collect a stool sample and it tests positive. And then what happens if you test positive is the public health authorities in your state or local district are notified, and two things happen. One, they contact you for an interview, right? And they're going to ask you about what you ate 2 to 3 weeks ago. And it's really hard for people to remember that. And that's the only way we're going to figure out how, what's causing this outbreak. The other thing that happens is that the clinical lab sends a small sample of the pathogen over to the public health laboratory, where ideally they would do additional genetic testing to get kind of a fingerprint of the bacteria or of the pathogen that they can then compare across the country. Now, cyclospora, the methods for doing that are not as advanced as for other pathogens. And so the challenge is that, one, we don't have the laboratory capacity to get the same level of DNA fingerprints that we've had for other pathogens. And that's coupled with the fact that when we ask people what they were exposed to, we're asking about exposures 2 to 3 weeks ago.
Okay, so it is not just this, would we call it an incubation period then of a couple weeks, but it is also not being sophisticated enough with the type of laboratory work in place that is contributing to this mystery. But I guess what this brings to mind for me is that a year ago, the CDC quietly pulled this parasite out of a surveillance network. It's called FoodNet. Now, Michigan was never in FoodNet to begin with. Only 10 states are. But I'm wondering, Professor, how did that decision impact Michigan, if at all?
So I think that there's an indirect impact because our public health system, and as your speaker, your previous
Kate
speaker
Guzman,
said,
yes.
yeah, she said, I mean, she has epidemiologists, she has communication experts, she has inspectors, and those are all funded through a variety of mechanisms. Some are funded through public health preparedness grants that may come from CDC. Some are funded through infectious disease grants that come from CDC. Some are funded through food safety grants that come from CDC. Now, we've seen cuts across the board to public health in the past 2 years, and I would say public health was never fully funded to begin with, right? So this isn't just a new problem. We were moving in the right direction, but I think those two things, I look at it as those two things really are impacting the ability to figure out this outbreak as fast as possible. So what happened with FoodNet, they did go from 8 pathogens to 2 pathogens. The reality is they were never funded to do 8. They were making do, right? They were pulling all their pennies together to make it happen. And at some point, they recognized it was no longer sustainable, and they had to prioritize, and they had to make some hard decisions. I think all of us do want them to do 8 pathogens. I think they want to do 8 pathogens. I think the problem is that they do not have the funding they need to meet the needs of the American people.
You're saying, Professor, public health was never fully funded in the first place. I realize there is a huge mission to cut down federal government workers. So you're saying there wasn't room to make the cuts that have been made? Because I was wondering, I mean, could those cuts have been necessary? Was the federal government bloated in certain ways? As some have said, certainly that was the mission of DOGE, which, of course, has now sort of disappeared after making some cuts that have upset many people and have pleased others.
Yeah, well, I think really one of the challenges is that the public health system and the funding for that system, I look at it as a puzzle, right? You've got different pieces of the puzzle. FoodNet is just one of those pieces of the puzzle. When you start cutting, you start really pulling pieces of the puzzle out, and it makes it really hard to see the entire picture. Okay. And I mean, on top of the funding cuts, we've had a lot of people leave government agencies. We're talking about the brain drain that's happening. And ideally, if public health is doing its job, you don't know about us, right? And um, one of the challenges is that prevention is really hard to quantify. Well, we haven't had a problem in a long time. Why do we need to keep funding this, right? I would point out that the group at CDC that is in charge of parasitic diseases, including cyclospora, is also in charge of New World screwworm, which is all over the news because it's now in the United States. Well, how are we keeping it out of the United States? We were funding a surveillance program in Central America that got cut without fully understanding why we were doing surveillance in that area of the world and why it was beneficial to Americans. We got rid of that. We stopped funding it. New World screwworm came up. It's now back in the United States. We haven't seen it in the United States for a long time. And you've got the division at CDC that's working on this in collaboration with USDA and other agencies. And they're now also dealing with a cyclospora outbreak, and they were not fully staffed to begin with. You get overwhelmed, right? We all do when we have a lot. And one of the things we need to make sure our public health system is capable of doing is responding to the surges when they happen.
Professor, I realize you are a person of science, and yet I hear some emotion in your voice here that you're trying to quell as you tell this story. I mean, it sounds like you're deeply frustrated with what you're seeing in this moment. Is that fair?
That is a fair assessment, and this was something that I was very concerned about. We have made investments in our surveillance systems over the past 30 years that have really led to being able to identify outbreaks quicker, which means they're smaller. It means that we prevent illnesses. So every one of those cases is an individual, a family, and a community that's being impacted by, cyclospora doesn't cause a lot of serious complications. It has been associated with things like reactive arthritis, which also can impact quality of life. But I don't know about you, there's a lot I would do to avoid explosive diarrhea for days or weeks at a time. And there is a cost in terms of medical costs, lost productivity, loss of going to your job. So yes, I get very frustrated because I think if we invested appropriately in the system, we would have better outcomes.
Could we zoom in on Michigan for a moment here because it's at the epicenter of this? I mean, it has counted more than 3,300 cases, and the CDC's confirmed national number is under 900. You're an epidemiologist. When the local number blows past the national one like that, what is that gap actually telling us?
I think one of the things that we have to really be aware of is there is a lag between what happens at the state and it gets reported to that group that I talked about at CDC, the parasitic group at CDC, and they're dealing with this and New World screwworm at the same time, okay, with limited capacity. And so tends to be a lag between the time the state report, there's a lag for the state to report it because they're overwhelmed. And then there's a lag once the state reports it to CDC, they have to process it. One of the things they're trying to determine is this a domestically acquired case of cyclospora or is it internationally acquired? And I think the other piece that's really hard right now is we don't know if this is a single large multi-state outbreak or if we have multiple simultaneous outbreaks happening. Clearly, there's something happening in Michigan and Northwest Ohio. If you look at they're clustered and have a lot of cases, but we don't know if they're connected to, say, the illnesses that are happening in Colorado or North Carolina or California yet. And that's where the CDC comes in to help us figure that out.
This is the Metro on WDET. I'm Robin Vincent. If you're just joining us, my guest is Barbara Kowalczyk. She helped build America's modern food safety system. Today, she leads the Institute for Food Safety and Nutrition Security at George Washington University. But before any of that, she was Kevin's mom. In 2001, Kevin was 2.5. He ate a hamburger, he got sick, and 12 days later, he was gone. Professor, you've said he spent those last days begging for water. That's the grief that put you in this fight. What did food safety look like back then?
Well, I would say, things have evolved over the past 20 years. And back then, we were focused mostly on the safety of meat and poultry products and particularly beef. We were having lots of outbreaks related to beef products and particularly ground beef related to E. coli 0157H7, which is a Shiga toxin producing E. coli. There wasn't as much attention on fresh produce. And really, so it's really complicated, but USDA oversees the safety of meat, poultry, processed eggs, and catfish. FDA oversees everything else. And FDA's food safety laws had not been updated in more than 70 years. So there was a lot of work that went into it. A lot of people worked on this, not just me, just want to make that clear. But in 2010, we passed the Food Safety Modernization Act, and President Obama signed it into law. And it's often referred to as FSMA. Okay. And one of the important things that FSMA does that is related to this particular outbreak is FSMA required companies and the agencies to be able to do traceback, right? So once we find out, I know Michigan authorities have come out and said they suspect bag salad. In that bag salad, we've all seen them. There's lots of different ingredients. You could have arugula and romaine and spinach, and you might have herbs like cilantro or basil in that. And so right now what's probably happening is they are looking at the salad kits that people purchased and reported consuming, they're going to those companies and they're starting to work on the traceback. And they were likely doing that in collaboration with FDA. And they're going to try and go back and see if there is a common supplier or source. So then we can learn from this outbreak. As hard as this outbreak is, it's even worse if you don't learn anything from it to prevent the next one.
So your work on this has truly been transformative for food safety. In this moment, I'm wondering, back to the loss of Kevin, how that sits with you when you feel like food safety is getting deprioritized. And am I assessing that right to say that you feel it's
Yes.
getting deprioritized?
I feel it's being deprioritized and I feel it's not being funded. And I find that extremely frustrating. And it breaks my heart for the families uh, that are still being impacted by preventable foodborne disease. You know, I'm involved in a lot of different groups, social media groups, and I'm in contact with other families. And I can tell you there are kids that are in the hospital right now fighting for their lives against the same pathogen that my son had. And it's unnecessary. These illnesses are preventable. And I think as a country, we need to invest more in it. CDC's overall food safety budget, half of which goes to the states, and most states don't fund foodborne disease surveillance on their own, is $74 million. That's a rounding error in the federal budget. Um, you know, if you calculate it out to the cost per American, we're talking less than $1 a year per American for foodborne disease surveillance. Quite frankly, a lot of us spend more on a cup of coffee.
Mhm. And of course, as you mentioned earlier, when public health is done well, it's invisible. It's only in these moments where there's a really big challenge, where an outbreak emerges and public health officials are, let's say, scrambling to trace it. It's those moments that we then see it in action. But for you, as someone who has worked behind the scenes, what I'm hearing you say is that is where you would prefer to be, is working behind the scenes, wearing your prevention hat and not the proactive investigator hat.
Absolutely. I mean, I would much rather focus on prevention and being proactive than being reactive. And, you know, waiting to do something after an outbreak occurs is not what we would prefer to have happen. We've known cyclospora is a problem. We know that we need more investments in our state and local public health systems. We know we need more investments at CDC, but we know we need more research on this topic. But we as a country have not invested at the level that we need to.
Okay, well, let's think about that a little bit more deeply, if we could. Being proactive versus reactive, what are the cost differences? I mean, if you can just more loosely kind of paint that picture when it comes to either us investing as a country into prevention versus the cost of trying to figure out this outbreak and where it's coming from.
Right. So there's been limited studies, but there was a study that looked at the cost benefit of another surveillance system called PulseNet, which is one of our main foodborne disease surveillance systems. And there was an economist that did an economic analysis, and they found for every dollar invested in PulseNet, there were $70 of avoided medical costs and lost productivity just due to 3 pathogens.
Hmm.
$1 investment, a $70 return, that's amazing. I think we'd all invest in that. There was another study that looked, CDC invested $22 million at the state and local level to bring everybody up to modernize their laboratory methods they were using for foodborne pathogens. And that resulted in a $500 million reduction in costs associated with medical costs and lost productivity. Again, 22 million, you get a $500 million return. we talk a lot right now about preventing chronic diseases, preventing infectious diseases. That prevention, yes, it costs money, but in the long run, it more than pays off. And what a lot of people don't know is that many foodborne pathogens, foodborne illnesses, are associated with increased risk of chronic diseases like irritable bowel syndrome and reactive arthritis. Cyclospora has been associated with reactive arthritis. That has a huge burden both on our medical system, but also on the individual.
Professor, I think that folks are listening to this right now and some are feeling perhaps a little bit frustrated or powerless. They're thinking, what can I do in this moment? And in our next segment, we're going to explore local agricultural systems and how they differ from large-scale ones where these outbreaks tend to originate. You told me buying local produce doesn't necessarily mean you're safer. From a food safety perspective, do you see benefits to buying local produce?
I mean, I think, the pathogens don't know the difference between local and non-local produce. So from my perspective, diet diversity, there is some very limited evidence that may be protective against foodborne disease. And so making sure you eat a diverse diet, I think is important. I personally like to buy local, but I also understand it doesn't mean that it's safe. Okay. All food comes from the ground or animals. It's not produced in a sterile environment and it all has risk. I would say, in terms of what can people do, right now, Congress is thinking about the budget for the next fiscal year. Contact your representatives, contact your policymakers, and let them know this is something that you do want them to invest more in.
Barbara Kowalczyk directs the Institute for Food Safety and Nutrition Security at George Washington University. Professor, thank you so much.
Thank you for having me.
It's the Metro on WDET. I'm Robin Vincent. Coming up, a Detroit farmer who studied dangerous diseases before she ever grew a tomato. She'll talk about local agricultural practices and how they differ from large-scale ones. And you can join the conversation. The phone lines are open. How do you feel about the public health response to the cyclospora outbreak? And what are you doing to keep yourself safe? The number is 313-577-1019. We'll be right back.